Good afternoon, everyone. We're just going to let all the participants get into the webinar. The numbers are climbing very quickly. This was a record for a restaurant and catering webinar with nearly 300 registrations, and we are now passing very quickly the 100 mark, and we do expect that it will pass the 200 mark. Wow, watch how fast that's going up. We very much appreciate members coming to us as the single source of truth for the hospitality industry, and the record number of attendees in the webinar is certainly a sign of that. So we're just going to give it a couple more minutes to let everyone get into the webinar. The numbers keep climbing, and I just want to make sure that all of you are able to participate in the entire webinar. Number keeps climbing. We are well on our way to getting to 200. Yep, so we have had a couple of notices in the chat that we can be heard, so beautiful. Okay, so we've hit a number that I'm comfortable starting the webinar. So thank you, everyone, for joining us for this very critical webinar around vaccinations. And we certainly do have a lineup today between Brendan Zhu, our new manager of workplace relations, and Tom Green, our head of policy, to walk you through what we think is a very complicated issue that is rapidly changing every single day. I'd like to start with an acknowledgement of country. We are presenting to you from the traditional lands of the Gadigal people of the Eora Nation, and we pay respects to their leaders, past, present, and emerging. So there have been lots and lots of news articles. There have been lots and lots of commentators on TV, the premiers around the country, the public health, the chief health officers, and the health authorities have been speaking about vaccinations. The Fair Work Ombudsman has weighed in on the issue with a 4-tier system. So certainly there is a lot of information out there, and it is very important that you get the right information that is correct and accurate as at today. What we do know, both federally and in most states, is that reopening the hospitality industry once we get to 70% vaccination is a reality. It's not ideal, meaning that many of you may have your own personal or business, and your staff may have their own personal and individual opinions and ideas around the vaccination and whether or not it should be mandatory. So it is very important that we give you the right information, that factual information that has come through from the authorities thus far, so that you can make the right decision for your business, and your employees can also make the right decision. But we do expect around the country that businesses and staff in those businesses, as well as patrons, will most likely need to be vaccinated to enjoy hospitality, at least between that 70 to 80% threshold. Restaurant and Catering put out a survey a couple of weeks ago, and when it closed, 64% of the hospitality industry wanted the government to mandate vaccinations, so take it out of the hands of businesses and make it a responsibility of government. 63% of hospitality businesses wanted the ability to be able to mandate the vaccination for their staff. And about 53% wanted their patrons to be fully vaccinated to enjoy hospitality. So it certainly is an issue that is on the minds of hospitality businesses, both for their staff and for their patrons. Restaurant and Catering's position is that a business should be able to choose, and we will support those businesses that do mandate vaccinations if they feel that they fall into the categories that are allowed by the Fair Work Ombudsman and by public health orders around the country. So now I'm going to hand over to Brendan Zhu to continue the conversation. And after that, Tom Green is going to field all of your questions. So please be sure to get those into the chat as you have them. Don't wait until the end of the webinar. It's very important that if you have a question that we can then begin to work on the answer. Brendan?
Thank you, Wes. And thank you to all our members who are on this webinar as well. The reason why we do this is because you have either called the IR hotline, and obviously I've been answering some of your questions, or you've been asking us for more webinars on topics such as these. And I think this is a great example of a member-initiated webinar. That's something that you wanted and that we're providing for you as a result of this. And so by all means, if you have any other webinars in the future, topics, anything you'd like more information on, don't hesitate to be in contact because we are here to serve you, the membership. And this is an example of that. As Wes alluded to, mandatory vaccination for staff is a very big topic. It's a very big topic for employers all over Australia. And of course, it's a big topic for the hospitality industry. We would know that the hospitality industry is one of the first to face restrictions and one of the last for them to be relaxed whenever there is a community outbreak. And so it is very important for you and I as a result. You may have heard Fair Work over the past few weeks give advice or to provide information about vaccinations, and you're confused. And I completely understand it. It's fair enough. It is quite confusing what you have to navigate through out there. You're trying to understand public health orders. You're trying to understand how you can keep your businesses afloat. And you're trying to think about what does it look like to reopen and for restrictions to relax. And to give you a rundown of what the Fair Work Ombudsman have said with the 4 tiers, they've essentially categorized employers into 4 different tiers. So the first tier are those who they say are involved and directly in contact with those in the border force or hotel quarantine, in direct contact with international travelers. The second tier are those who they say deal with customers or patrons or clients who are vulnerable, the aged care industry as a result. Then you've got the third tier who are employers who they have to interact with customers at a face-to-face level. There's an inability to work from home for third tiers employers and businesses. You have to interact with people face-to-face. And then you've got the last tier, which are employers who have an ability for their staff to work from home. For example, those who are in an office environment. Now, at the moment, what the Fair Work have essentially said, and this is from the get-go, the first 2 tiers are more likely to be able to have mandatory vaccination for their staff. For tier 4s, it'd be unlikely to be able to mandate vaccinations for your staff. And for tier 3, which is essentially the hospitality industry, those who cannot work from home and are dealing with customers and patrons face-to-face, they would say that you can do so when the direction is lawful and reasonable. And we're here to kind of get down to what does that actually mean? It's easy for them to say you can do it if it's lawful and reasonable. What does that actually look like for it to be lawful and reasonable? So, some of you, and I've certainly spoken to the members who have called the IR hotline, who've asked, how do companies like Qantas or SPC, how are they doing it if that's what they're doing? Well, with the Qantas one, for example, they would be tier 1, dealing with international arrivals. If you're a catering company that deals with hotel quarantine, as some of our members have inquired with us in the past, you may, and particularly in your states, have found that you are required to vaccinate your staff. Whereas for some of our other members who deal, let's say, with catering for aged care services, who would therefore be more likely to be in tier 2, you will find there may also be directions and directives from the state government in terms of public health orders. But for everyone else who is in this tier 3, this lawful and reasonable test, ultimately, because there is no guarantee, as Wes alluded to earlier, there's no guarantee in terms of what the federal government has allowed for mandatory vaccination. We may see public health orders in various states, as New South Wales has led the way, where certain industries are required to vaccinate. And you may see that being replicated, whether you're in WA or whether you're in Tasmania, wherever you may be, even if there's not a current outbreak, the gradual relaxation of restrictions, where even if there is COVID circulating in the community, we can look at the example in New South Wales as a starting point and as a precedent for what the other states may follow. And really, in terms of how, or if there's no guarantee from the federal government, what can you do as a result to at least reduce your risk? And we use the SPC one as an example. With SPC, they would have had their own legal advice as well to help them reduce their risk. They could face an unfair dismissal claim later on when let's say they ultimately terminate a staff who refuses to be vaccinated. It's no guarantee when they made those media release announcements that won't happen. And so there is that element of a legal risk, and it's all about how do we reduce that risk. So one of the things that the Fair Work have certainly said in our conversations with them is they encourage, and certainly we do at R&CA as well, is if you have a specific context in mind for your business, to consider that legal advice as well. There's something that you can have from your legal advice in writing about your context and what steps you can take. And we certainly know that there are a few things that you can do as a result to reduce your legal risks. One of the things that we have seen, which is an important aspect, is consultation with staff. It is surveying your staff and giving them an opportunity to speak about any potential workplace policies for mandatory vaccination. If you want to have a company policy that mandates the COVID-19 vaccine, the ability for staff to be a part of that process at least allows them to contribute and to have their say. Whether they don't use that opportunity, that's up to them, or whether they voice their concerns, have you taken it into account, then as long as you have conducted a consultation provision, then you will be, as a result of that, that will go a long way in informing your employees, but also bringing them along the journey. Often you hear when I speak to our members with the IR advice, there is what is legally permissible, but also what is the best in terms of HR, in terms of team morale, in terms of strategic approaches. You want to bring your staff on board that journey so that they know this is coming anyway. So consultation is certainly the big one, and especially if you have existing employees. Now, if you have new employees that you are looking to hire, any employment decisions from here on out, you could certainly put it as a very express term in the contracts that they sign. Now, when your prospective employees have signed a contract which states that, upon your request as the employer, that they will be vaccinated and demonstrate proof of that, employers and employees are more than entitled to come up with express terms that they want, as long as it doesn't go beneath or doesn't contravene the award or the NES. So you can certainly have terms in your contract for any new and upcoming employees as well. But for your existing staff, certainly the policies are the way to go, and a consultation is very important towards that. Now, the other thing to keep in mind, of course, what we have found and what Fair Work in their consultation with us have said is that where you are in a priority local government area, or you are in a hotspot of sorts, that is more likely to be in the employer's favor being able to mandate. Look, they don't use words that guarantee it. They don't use very express terms to say you can definitely do it. They've certainly used rhetoric and language to us that have suggested that employers in priority LGAs, where there is an affected by public health orders, it is more likely to be found as reasonable. And so therefore that reduces your risk as well. And so certainly for our employers and for our members who are currently in an affected LGA, that is something to keep in mind. Whereas if you're in a state where there are no current community cases, whether it's an SA or WA or wherever it may be, you are less likely to be able to do so in terms of mandatory vaccination policy. But you will see here, these are all different factors. It's different factors that go into basically weighting the basket to determine whether it's lawful and reasonable. Consultation will be a factor. Your public health orders will be a factor. Whether it was in their contract will be a factor. And all these things are aimed to help reduce your risk when you go ahead and try and have a mandatory vaccination policy for your staff. One of the other things to consider as well, of course, is privacy. Whether it's one thing to mandate vaccines for your staff, but will you be able to ask them to show proof? And that's certainly a question that we get quite a bit as well, which is a very fair question. One of the things that's very clear for small businesses, under the Australian privacy principles, those concerns that you may have in terms of privacy, for $3 million or less for small businesses, you are not under that. Now, I guess that's the first assurance for you, in the sense that you might have heard a lot of things, you might have read a lot of articles, you might have seen a few things go viral, you may have seen a few Facebook comments who say, you can't ask me that. Well, the news for small business is you can ask your staff. Now, obviously, there are things to consider as well for those who have a genuine medical exemption to vaccines. And that's something that you'll have to navigate as well. When people show some sort of letter from their doctor, a medical certificate, which demonstrate, they at the moment, they can't get a COVID-19 vaccine, or they can't get this particular one, so they have to wait until it opens up. And that is certainly something that you also have to keep in mind as well for those with a genuine medical exemption. Because, if they have a genuine medical exemption, then you will need to think about those exceptions in your workplace policy as well. And lastly, overall, we see and we hear a lot in the news. A lot of this will continue to evolve over time. With each new public health order, with each new outbreak, every time the restrictions relax, as the vaccine, and as Wes alluded to, as the vaccine rollout improves, and as we start seeing the lack or an alternative approach to the elimination strategy, this will continue to be very pertinent and continue to evolve over time. And so to remain up to date with the latest, I wouldn't be surprised if we had to run this vaccine webinar again in another month, another 6 weeks, and 2 months, because a lot of this will be outdated because of the evolving situation. That's where it's at currently at the moment. And I'll just finish off with one thing in terms of the resources that we have at R&CA before we go to Tom with some of the questions that we have, but also to wrap up some of the other comments as well. Here at R&CA, we do have a variety of resources for our members. You may have seen in our emails the workplace policies and guide in collaboration with ACI, which was a very robust guide for you to read and for you to consider what does that look like for your place of employment. We have as well something that we've developed and we'll be launching today as well, and I'll certainly post in the chat. It's a list of the vaccination hubs in all the different states and territories in Australia that you can send your staff to be vaccinated. Now, you can have a conversation with them. You can send them this email. You can send them the list for them to be vaccinated. And lastly, for some of our members who have already done this or are certainly seeking to do this, who want to be able to demonstrate to their patrons that all their staff have been vaccinated. Now, before it's been mandated, before you've done a workplace law, you've been able to have the conversation with them to win over your employees, and well done to the members who've been able to do so. We want to be able to demonstrate to everyone out there that all their staff have been vaccinated. There are vaccine posters as well for you to use for your business that we have produced at R&CA. And so we'll continue to develop some resources. Keep an eye out on those emails. And as always, if you have any questions, feel free to be in touch, but I'll leave it over to Tom now.
Thank you, Brendan. And I might just double check that everyone can hear me okay. I've had a couple of small internet issues. If I do run into a problem, I will take off my microphone, my video, sorry. Vaccinations in our industry, to borrow a phrase from our former Prime Minister, Paul Keating, you can go into every pet shop in the country and the resident galah is going to have a view on vaccinations and the legality of mandates. But this is really the challenge that our industry is facing at the moment. I want to take a couple of questions that have been asked that generally deal with restrictions. And I'm going to assume that these questions are coming from New South Wales. I don't know that they are. You know, really asking the question around, well, what is 70% going to look like? What are the rules that are going to be in place, and how is this going to work? What we expect is this, and we've had these discussions as recently as today with the New South Wales government around their thinking. We expect that a roadmap, and when I say a roadmap, I mean a genuine roadmap of what 70% looks like and what 80% looks like, to be released very, very shortly. It could even be as early as this week. I think it's more likely to be a bit later. They have indicated quite strongly that 70% is going to be the market that our industry reopens. And it's going to reopen not with what we've seen through the previous reopenings from lockdowns, which is, you know, 10 people here and 10 people there and, you know, tiny numbers. They are expecting broad scale openings of entire industries. Yes, there will be some density rules and restrictions, but the real kicker for this marker at 70% is going to be vaccinated staff and vaccinated patrons. And they are making it quite clear in what they are using here is really, and we've got to see it as a carrot approach and not a stick approach, that they are saying that if you have been double vaccinated, you will get out of lockdown sooner. And that is based on their health advice, saying that it is not safe for unvaccinated people to be out going to venues and wandering around, but it is safe for vaccinated people. And that's what 70% is going to mean. We expect that once we hit 80, which will be, you know, 4 to 6 weeks after that 70% figure, that things will start to open up for everyone. So an important, I think, reassurance for a lot of business owners is that there is a horizon this year in states like New South Wales where businesses are open fully to both vaccinated and unvaccinated people. Now, that will require at 70 a little bit of managing. And I really suggest, if you haven't, signing yourself and your staff up to the managing customer expectations micro-credential that R&CA has put together, because if you are adding a vaccination status to the check-in when people are coming into venues, which the New South Wales government has made very clear is going to be their expectation, that is going to require another point of customer expectation management that your front of house staff will need to employ. So my strong encouragement is to take a look at that micro-credential. Finally, we do expect there to be some level of easing or greater easing for outdoor dining. And the reason for that is we know, and all the health data points to the fact that dining outside, gathering outside is a safer proposition than doing so inside. So our strong view, and it's something that we've put to government multiple times, is when there is a reopening, that outdoor dining should be as free as possible, and that businesses will need some help restarting. Now, that will include a grant top-up arrangement. For those of our members in Victoria, you'll know what those top-up grants feel like. You've been pre-approved for grants, they just add more money into that account, and the purpose of those grants is twofold. One, to assist you in meeting the cost of renting or purchasing outdoor furniture, and two, to allow you to get access to those high-cost perishable items that you'll need to stock your fridges full of in order to reopen once we do hit the other side of this. I wanted to cover that off. That's probably 5 or 6 different questions all kind of battled together in that answer. But what I would now want to do is take some of the more specific questions that are being asked. And the first one here, Brendan, I think is really one for you, which is, you know, if you are a small event venue that has a strong business position regarding freedom of vaccination choice, this is an environment where it's not a legal requirement, but it's a business choice. Do you think that there's an option for employers asking for employees to sign some sort of indemnity style document prior to commencing work post lockdown? So this is in an environment where the staff members are not vaccinated, or there's a choice for staff members to get vaccinated or not be vaccinated, and for them to come into work in an environment where we've reopened after lockdown and there are cases in the community. What are the indemnity rules that are in place now? What are the allowances that businesses can put in place? And I know that there is also some information about indemnity schemes from the federal government, if you want to touch on all of those.
Yeah, I'll just touch on a few of the indemnity related ones, especially with workers' health and OH&S. There's also, so another question that what happens if someone's unvaccinated and your OH&S obligations. So for employers, in terms of managing a place of employment and their workplace and managing risk to employees, whether it be about food handling or, the more traditional things that we'd have seen in a pre-COVID context, and even now, of course, COVID and diseases. The risk management is the important element of that. So, one of the things that we've been seeing and have been passed in terms of communication as well, is they will look at a matrix of factors. It's certainly not vaccines only. Vaccines will not be necessarily the golden thread between you fulfilling your requirements or not. There will be things like having that COVID safe plan in place, having and enforcing those density requirements, the availability of hand sanitizers, wearing a face mask for staff, whether they be front of house, obviously, but also if you want to consider it in terms of back of house. All these factors will contribute to the matrix. And so the vaccine is certainly one factor as well, but it is not the only one. The vaccine is a factor, but it is not the only factor, which, just because you have yourself vaccinated doesn't mean you can therefore be relaxed or compromise on the other ones as well. You certainly want to have that risk management plan in place and do everything within your ability to ensure that you are managing a safe workplace. So with that in mind, it's not just the vaccine. So for the members who I can see are concerned about, if you have that one staff who has a medical exemption or whatever it might be, is to know that there are other factors that are taken into account and to make sure that you're doing all of those as well. And so that's how, that's the approach with work health and safety. If you want to have an indemnity letter for your employees, look, you can, if that's something that you so wish to do, you can consider it. I would be wary of what happens if an employee refuses to sign it, or a bunch of them refuse to sign it, and then in a sticky situation where a bunch have signed and a bunch haven't. But if employers and employees can choose to do these extra steps in place if you feel like you want to do so.
A second question is similarly related to some of the kind of legality issues that we're facing at the moment in the industry. You hear this word being bandied about a lot, which is the word discrimination. It's a word that people love to use at the moment, especially around vaccinations. If a business chooses to implement a vaccination mandate, or there is a public health order that clearly says you are not allowed to open your business unless your staff are vaccinated and the patrons that you allow in are vaccinated. And we know in a New South Wales sense, our QR code checking apps that we all know and love through Service New South Wales is going to be updated with your vaccination status to enable us to open at 70%. What is a business's liability or position around that discrimination question? Is it really discrimination? And how does that interlink with the public health order moving forward?
Yeah, I think for that, it's certainly for everyone is to follow their state's public health orders. That at the moment is quite literally the gospel in all circumstances, your state's public health order. And there will be exemptions in those public health orders as well. Disability in terms of refusal for employment or even for patrons, which there are some questions about that as well. Obviously refers to, either inherent requirements or characteristics of that patron, of that staff, for example, their gender, their religion, their sexuality, whatever it might be. Now, with exceptions to vaccines, depending on each state government's public health orders, certainly what we've been seeing at the moment so far is, there may be some medically exempt staff. And so how you want to go about doing that, I can see there's a few follow-up questions on those who are medically exempt, and what you should do with them. Yeah, I think for those, that's why there is that risk matrix of everything else that you can consider. I can see here there's a question, should you be having them let's say not on the front of house and serving guests. That is something for you to consider as well, for those who have a genuine medical exemption. I can see another question here. What happens, as a result, let's say there's someone who's got a medical exemption and then they're not vaccinated. There's a full-time staff member who refuses to work with them as a result. And now you're in this tricky situation where you're trying to balance between two, what seems like competing interests, in protecting your staff member, but also not discriminating against another one on the other hand. And so, for example, with that question, that really comes down to the contract that you've signed with them and whether that refusal is something that is permissible for you. And if not, then the intent is certainly for the employee to fulfill their side of their contract. And so that's the approach for that.
And I would add to that, in that example where you do have unvaccinated staff, from a work health and safety perspective, the business owner has a really, really clear obligation to protect their workers and their patrons in their business. And what I can certainly foresee as being a reasonable request of unvaccinated staff into the future, because you have to remember those unvaccinated staff are just as able to transmit the virus and are just as able to bring the virus into your business, spread it in your business, and then cause widespread kind of chaos and problems when you have more than one positive individual in your business. It may be reasonable to ask them to continue to wear PPE, even after the pandemic is over. Even after the public health order is completed, you may say, look, you're more than welcome to work with me and not be vaccinated, but it's reasonable for me to say, I'm going to need you to wear a mask whilst you do that, because there's that ongoing risk. And I think the real challenge for a lot of business owners, and it's a challenge that they've done a tremendous job of over the last 18 months, is really balancing the risk in their business. But I think one of the big questions, and it's been phrased by a few people here, and this is what I want to ask as my next question, Brendan. What are the types of rules that we expect to remain? Whereas I actually think this is really a question for you, because I think government is grappling with this as much as anyone else at the moment, which is, well, if I'm vaccinated and we're open, does my restaurant have to close if I get a positive case? Does my staff need to isolate for 14 days if they're vaccinated? Well, what if they're unvaccinated? Do all my patrons need to be notified by New South Wales Health? What's the process that we go to when we hit 70 and 80%? Now, privately, government really hasn't figured that out yet, but we're certainly at the forefront of this. What's your sense of what it's going to look like at 80%?
Tom, that's a big and loaded question. And I wish I knew the entire answer. But what I will say in continuation of your last question to Brendan, at present, for those of you that are around the country who may not be subject to the current public health order in New South Wales in relation to the 12 hotspot LGAs. So there is a public health order in place today that says if you live in 12 hotspot LGAs and you want to leave those LGAs for a allowed reason, which in this case would be to work in a hospitality business, you must have received the first jab. Now, that public health order applies to the individual. I know many of you have asked questions about how to enforce that and how you deal with it. The public health order, and what we expect the public health order to be for the 70% rule, not only in New South Wales, but around the country, is that it applies to the individual. So they are in breach of the public health order by leaving their LGA if they do not have their ID and proof of one jab. So you as an employer, when someone turns up to your business without their ID and proof of one jab, they are individually, personally in breach of the public health order. And so you as a business owner would treat them as they're unavailable to work. So let's say if you turned up to a construction site in a t-shirt, shorts, and thongs, and in order to work on a construction site, you needed a hard hat, orange vest, and work boots. So it is a workplace health and safety rule. It is a rule of the government that you can't work, you're not available to work if you are not abiding by that rule. So at the moment, that is how it is affected in New South Wales. So for any of you who have listed out questions about, is it legal to not, for your employees to not be put on the roster, or for your full-time employees to potentially be stood down, it is important for you to seek your legal advice if you are faced with that situation. However, that is the effect of the public health order, is that the individual is the one that's in breach, not your business. And we do expect that that's how it's going to continue into the future. For those of you who have some specific questions, I think around events or around types of things, ultimately, public health orders would stand above your contracts or stand above anything that that is affecting you and your business. It's the individuals at the moment that are required to do things. And now on to Tom's question about what we expect for the future. Ultimately, in speaking with not only the New South Wales government very closely, but also the Queensland government and the Victorian government, and to a lesser extent ACT, who are racing through vaccination of their state and expect to get to 90% by the time Australia gets to between 70 and 80. In speaking to the government, we do expect that there will be public health orders or rules that the government puts in place in relation to things that happen at 70%. Else they would not be standing up at the press conferences every morning saying that freedoms would be afforded to those who are vaccinated at 70%. Only the government can affect things like that. We do expect that there will be some density and capacity restrictions between 70 and 80. And I know that you're all probably jumping up and down saying, but everyone's vaccinated. Ultimately, the between 70 and 80 is still a trial. It's still a testing period to be sure that the cases, the hospitalizations, the ICU, and the mortality does not increase, so that when we do get to 80% of eligible Australians, that they'll be able to then potentially over the course of weeks and possibly a couple of months, get us back to a pre-lockdown or potentially even a pre-COVID environment for your businesses. But the governments are being cautious because the Delta variant certainly has taken hold in New South Wales and potentially Victoria and now ACT, and they certainly do not want to run immediately. So in the roundtables and the coalitions and the discussions that we're having directly with the ministers in every state is that there will be some restrictions, potentially less for outside dining and for events, and a little bit more for indoor dining and events in that 70 to 80 range. And then after that, as Tom said, the expectation that many of the requirements will fall away is expected. We do expect that that in that 80 to 90% range, that the governments will begin to abandon the QR codes. They'll begin to abandon the tracking and tracing and density as they learn to live with COVID, because ultimately the governments are trying to get to a point where it's treated from a public health point of view, similar to influenza. There will be stats on it, but there hopefully will not be a daily presser talking about COVID into 2022. So
no, I'm prepared to do something else with 11 o'clock every single day in my life at the moment. Thank you, Wes. And look, I really appreciate that answer. I think that's a very fulsome answer. I thought I'd just tackle a few individual questions and then pose the next one to Brendan. For those of you who are looking for examples to assist you in managing this in your business. Now, I can see questions from Georgette and questions from an anonymous attendee here around questions of liability and questions of assistance around how they manage these things in their business. We've also had questions around whether or not R&CA has a draft survey that they could send to their staff to get an understanding of their intentions around the vaccine, draft wording around a vaccination policy. These are all things that we are going to be developing, and they will be available for members very, very shortly via our webinar, via our EDMs and our emails that we send out twice a week. So my strong request would be to keep an eye out or give us a call. We are here to help, and we will be producing those those records and references. And if you are looking for, I just really don't feel like I have the confidence to have this conversation with my employees, give us a call. We're here to assist, and we're here to provide you with that information, with that data, and with that ammunition that you need to craft that workplace policy as you need to. There was one question here that I really did want to answer from David. It's an important one, because I think it comes down to, why is it that the government is mandating vaccinations, and really what is the purpose behind this? He makes a very fair point here around, people can still spread the disease. They can still catch the disease when they're fully vaccinated. So, why is the future of my business being tied to the vaccination rates of people who may never even patronize my business? And the reality is this: the place that governments want to move here, especially in Australia, is getting to a point where they start to treat COVID like the flu, or like like influenza each winter. And what they want to move away from is reporting cases and reporting hotspots and recording outbreak areas and reporting venues of concern and all those things, and move towards reporting two really, really clear numbers around the way that we treat COVID. One is hospitalizations, or what they call serious illness, and the others are deaths. All might sound very morbid, but that's broadly the way that we've kind of reported on the influenza outbreaks that occur each year that we've all got the flu shot for. The way that we do that is by getting vaccinated, because what the vaccines do more than anything else, where they are at their most effective against the virus, is in stopping hospitalizations and stopping deaths. Now, they don't do that to 100% figure, but they do that to kind of mid to high 90s percentages across all the different vaccine types. That's AstraZeneca, it's Moderna, it's Johnson & Johnson if you're in the US, or Pfizer here in Australia. So that is really the purpose, is transitioning society to a new place where we begin to report COVID in regards to hospitalizations and death. And I think that's a really important point to note. I think we're going to kind of touch on the next question from Raphael, Brendan. I might let you kind of translate it as its long question and then cover off, because really this is an important point for a lot of our caterers and a lot of our wedding and events coordinators. So I might let you cover this one.
Absolutely. So the question is, a bridal couple claim many of their guests for their wedding and maybe potentially themselves won't be vaccinated, and they want their deposit back, which is quite a hefty sum, as vaccinations were not part of their conditions of booking the venue in the first place, and wasn't part of the contract. And what can you do if they don't proceed? Are you obliged to refund them? And yeah, this could be something for a lot of our caterers, for a lot of the venues who deal with weddings. The first point, and a lot of it you'll find, is it is what was signed in the contract. It is what are the permissible things for a refund of a deposit. And as I can appreciate, and I'm sure many of us can understand, it might not have been something that we were expecting in terms of having a clause in your contract to allow or not allow for refunds based on vaccination rates. So in terms of what your next step should be, if this is something that is important to you in your business, to have all of the patrons, all the guests, if you do weddings, all the wedding guests, business functions, whoever it may be, if it is important for you that all of them are vaccinated, and that's your decision, and that's something you want to do, then obviously having that communicated to the patrons is important, such as it being a clause in your contract. If that is something that you want enforced with a non-refundable deposit, that all your guests at your wedding need to be vaccinated, and will be asked to demonstrate proof on entry, then you will want that in your contract to make it as watertight as possible. You want to seek legal advice as for the construction of that clause, as to the phrasing, and as to the rhetoric, and for the enforceability of that. Now, for everyone else who, let's say, I'm sure that's a lot of us who hadn't previously anticipated this or had foresight this would happen, what can you do? Yeah, your starting point is the contract at the end of the day. It is what is written on those pieces of paper that were signed, and your conditions of a refund and those terms and conditions. So certainly you'll have to read what was sent out to your clients, to those who paid a deposit, see what they've signed, see what the exemptions are, see what grounds there are for having a refund. And if there isn't anything to that, you may want to seek further legal advice on your actual contracting on those particular words that you've used in your contract and the situation. But that's where it would be at the moment.
Now, thank you, Brendan. I'm conscious of time, but I might just add this final point here at the end in relation to Raphael's question. We were only having this discussion this morning at R&CA, which is the kind of opportunities that rapid antigen testing provides for a lot of our catering and events businesses, especially the larger ones doing kind of gala dinners and awards and the like. These are the types of tests where they're supervised by a nurse, but you get the results within 15 minutes. And they're a lot more affordable than what they call the PGA tests, which are the ones that we've all been through, where you kind of drive up and they stick a swab in your nose and you get a result a couple of days later. These are much quicker. They're much cheaper and they're much simpler to administer. We've seen overseas how useful they have been in ensuring that COVID is kept out of situations where there have been, patchy vaccination rates, or where you haven't been able to rely on the vaccination status of people who are attending to be able to ensure that that event is COVID free. That may not work for everyone, but it certainly is an exciting opportunity, something that we're kind of really diving into as a really cutting edge way to ensure that some of those events do have the flexibility to proceed. And I might, Brendan, this is actually, I think, going to be the final question that we ask today, because I'm conscious of the time. And there's a really, really good question here from Vanessa, which says, what about regional areas that have had zero COVID cases? And this is something that the FOI has obviously kind of anticipated. If you are living in Western Australia and you are basically free of COVID right now, or you are living in Canterbury Bankstown, you may as well be living in different countries in terms of that COVID risk. So how is that treated under the FOI's tier structure?
Yeah, so, if you're not in an area where they have identified as a priority LGL or a hotspot, they have used words to the effect that, it's probably less likely for your ability to be able to mandate it in relative terms to a business that is in a priority LGA. Now, having said that, if that's something that you are still interested in doing, as I mentioned earlier, the thing you want to do is consider having it in employment contracts, because employment contracts are a private agreement between the employer and the employee, and you can have clauses to that effect. And if they've signed the dotted line there, then they have agreed for that as their condition. The other things you want to consider as well is your workplace policies, and implementing that and consulting with your staff about it. You might find when you have this conversation with staff, a lot of them want to get vaccinated anyway, and they want to do it, and it's not as difficult as a conversation as you expect. And some of our members have certainly found that they haven't needed to go to the lengths of a mandatory policy, because they've gone the more strategic route of just winning them over and having that conversation with them. And certainly that is the best way forward. And you will see in our guide that we sent and co-authored with Aki, having that conversation was step one. These mandatory policies are the ones that we want to save as a last resort. And it's always best HR practice to keep that in mind. But also to think about the other matrix of your risk mitigating things. So things like face masks, hand sanitizers. I can see here one of the other comments was, what if you decide for those who are unvaccinated, they have to go through COVID testing every week, or an employer one, or whatever it might be. Again, employers can choose to have workplace policies that require things from the employees that aren't necessarily the bare minimum of what the government has expected. You can go above and beyond to ensure that you're reducing as much risk as well. So if you want your unvaccinated staff to have COVID testing every week or every 4 days or whatever it might be, then you are welcome to explore those options as well. And so that's the way to go, especially for some of our members who are in a regional context where there is no community transmission. As you would have heard, and I guess the main underlying principle is Fair Work have not given any guarantees. And we'd be lying if we said yes or no. But they have said you can do things that significantly reduce your legal risk. And so I reiterate my earlier point, and that, it's constantly evolving. So stay up to date with the information, but also to see if there's any more specific advice you can get for your particular context in your geographical location, in your environment, with your staff in mind. Back to you, Tom.
Wonderful. Wes, I think over to you.
Yeah, so in closing, we know that because many of you are located all around the country, that there will be many different rules in place for where you are. And that's okay. That is the nature of this pandemic, that every state and within each state, both the regional and CBD or more populated areas are often running different races with different rules. So you will be subject to different public health orders. In fact, you may be a business owner who has businesses in different states, who has different public health orders or different rules in each state based upon that state's public health orders. But we will continue to be here for you at Restaurant and Catering. No matter what you decide to do, we certainly mandate that you have a choice as a business owner based upon your status according to the Fair Work Ombudsman, and also based upon the public health order of your state. So we always support the public health orders. So if a particular state has a public health order that does require vaccination, we are bound to follow all laws that are on the books at any particular time. We certainly will lobby for members based upon those rules, but it is important to note that when rules are put in place, that we must follow those rules. And certainly it is an issue that is changing almost day by day. Like Friday in New South Wales, in the morning, rapid antigen tests were an option, and by 8:37 p.m. they weren't. And many businesses had gone to expenses as high as $40,000 to put together their rapid antigen testing routine, only to find out that it was no longer an option. And so, yes, we do expect that day by day, public health orders will be issued. Yes, day by day, the Fair Work Ombudsman may change their potential advice around mandatory vaccines, and also defining what mandatory is. The word mandatory, in the sense of sometimes premiers or even the Prime Minister, they'll often use the term that they would never mandate a vaccination. And oftentimes that means that they would not force you as an individual to do something, to force you to take a vaccine or to do something as an individual. That's absolutely the government's position, is that they will not force you to do something. However, through the instrument of public health orders, they can limit the activities that individuals and businesses are able to conduct if their vaccination, if they have not yet been vaccinated. So they're not the same things. To mandate something and force you to do it versus to pass rules around what you are able to do if you are vaccinated, they're separate issues. And certainly that can get lost in the conversations in the morning pressers of the premiers and the Prime Minister, the differences between those two things. So thank you so much. This was the most attended webinar in restaurant and catering history, and we certainly appreciate the team behind this. Kieran, who put this together, and Belinda, who gives us all the wonderful advice, and Tom for doing the Q&A, and finally, Brendan for answering the very critical questions. So thanks everyone, and we very much appreciate it. And we'll keep you updated with the next date for the vaccine webinar when more information is available. Thanks everyone.
Thank you all. Cheers.